Can we see the screen here? Can you give me a thumbs up if we're seeing the CoolSculpting? Perfect. Thank you. And again, we have the volume turned off for you participants just to make it a little bit easier. There's no like background noise or anything, so everybody can get all the information, and that includes our wonderful estheticians. They are silent as well until we bring them on board. So just be aware. Let's see. And I may have to allow people into the meeting as we progress, so just be aware that I may have to do that during the process. Hope everybody's having a great day. We're already halfway through the week. Ugh, it's amazing. And I just wanted to let you guys know throughout this process, instead of having you guys turn on your mic in order to ask questions, this is for participants, not our presenters. If you want to ask us any questions, please feel free to put your questions in the chat box. I will be moderating those throughout the presentation, more so towards the end. So just make sure that if you have any questions, you place them there. And then if we don't answer your question, I'll go ahead and get those answered for you. Perfect. Let's see, what time are we looking at? I'm gonna go ahead and get started. As I said, we'll probably be inviting more people in as time progresses. So I may, just in case the flow is a little bit off, this is one of our first attempts at doing this, so please bear with us, but we are super excited to have you here. We are all advocates of CoolSculpting. We love what this procedure offers. And I'm super excited to have our providers talk a bit more about what this offers today. So without further ado, I'm going to introduce Dr. Ted Lane. He is our Chief Medical Officer at Sanova Dermatology. We are so lucky to have someone that is so talented and gifted in both medical and surgical cosmetic dermatology. He runs the gamut research. Again, we're so grateful to have him. I'm going to let him take over and talk a little bit about what CoolSculpting is, and the technology of CoolSculpting, and then we're actually going to pass the baton on to the different estheticians at our practice that do the procedure, perform the procedure, to let them answer some questions about the process of CoolSculpting in general, and to tell you about their experiences with it and why they love it so much. So Dr. Lane, I'm going to go ahead and give this over to you now. We're super excited. Thank you so much for joining us today.
Thanks, Taylor. Thanks, everybody, for joining as well. This is a great time of year to start thinking about CoolSculpting. First of all, the first word, cool, makes us all a little bit happier right now, and what's going to happen the next couple of months. So let's go on to the next slide, Taylor, please. Okay, yeah, I'm the Chief Medical Officer of Sanova Dermatology. We are a group of practices in Austin, San Antonio, Houston, and Louisiana. I personally work out of 2 locations, in our Pflugerville office and our Steiner Ranch office, but we have board-certified dermatologists and excellent physician's assistants, as well as amazing estheticians and laser technicians available in all of our locations as well. Everybody with lots of experience. Okay, so what is CoolSculpting? Well, it's an FDA-approved device, and it's a method for us to achieve the reduction of stubborn fat. It's targeted and precise in the way that it's used, so that we're able to treat 9 different areas, and that's FDA approved for 9 different areas. And really, you won't see that in any other non-surgical method of reducing the fat layer. It's FDA cleared, as I said, and there's little to no downtime. I've personally had this done, and so I can tell you from my own experience, there really isn't. I've had it done and gone to the gym right after I was finished and gone to work the next day. So it is no downtime. Now, there is a bit of tenderness after you have it done. You definitely can feel that there's something going on in the area that you get treated, probably for 7 to 10 days was my experience, at least. I think most of my patients say that as well, that you feel a little bit of tenderness there, but it won't slow you down at all. Now, there's over 100 different publications and over 7 million treatments performed worldwide on CoolSculpting. So if you're worried about the safety of it, one of the benefits of using something like this, which has been so studied and has been used on so many people, is the fact that we have so much safety data on it. So we can tell you how safe it is based on your personal medical history, and our own experience and the experience of 7 million patients. So I feel very comfortable offering this in our locations, knowing that there's so much data to support its efficacy and safety. So the 9 different treatment areas that I alluded to before include the abdomen, so the mid-abdomen, as you see here, the flanks or the love handles as they're called. Going on to the back, you can do what's called the bra fat in the upper back or just along the lower back as well. It's indicated for use in the fat in the upper arm, also under the chin, called the Cool Mini treatment under the chin. And it's also, you can do it below the jawline as well. Finally, you can work on it underneath the backside area and on the inner and outer thighs. I would say most people actually get more treatments than just one area. Most people do a couple or 2 or 3 treatment areas at the same time, because usually that's the issue. So we definitely have the ability to treat more than one area at each session. And there are 9 different areas that are FDA approved for us to use. It all started with 2 really smart scientists at Harvard realizing that young children who eat a lot of popsicles are getting dimples in their cheeks. And that was because of the cold, the freezing of the fat. And what we know is that the fat cells in particular are actually much more susceptible to cold in terms of it causing cell death of those fat cells than in any other layer of tissue in our body. So that made them realize that there's an opportunity to target those fat cells with cooling, cause death of those fat cells, but protecting the other layers of tissue. And that's how the CoolSculpting treatment was started. Let's move on to the next one. So again, we target just those fat cells. It's targeted precise technology to trigger cell freezing and their death. We don't cause any other damage to the surrounding tissue because the fat cells freeze at a warmer temperature than the water in the other cells. So that's why we're not targeting the muscle underneath or the skin layers above, because we know that the lipids in the fat layer, those fat cells, freeze at a little bit higher temperature than the others. Now the cells die and the body's immune system just kind of flushes them out. So you don't see an increase in your cholesterol levels or your fat levels in your blood. I get asked that quite a bit with CoolSculpting. It's the body just kind of causes those cells die because of the cold treatment, and then they're flushed out. And that significantly reduces the layer of fat that we're treating. So one of the other questions and concerns that I have a lot of patients ask me about is if after the CoolSculpting treatment, do you get rebound fat in other areas? In other words, you notice that there's fat growth in other areas, which can be seen with liposuction, which is that surgical technique for removing the fat layer. Remember that we are really using precise technology and we're reducing the fat just in a very small amount to give great results. And we have not seen redistribution of the fat with CoolSculpting like that can be seen with liposuction. So in essence, because we're so precise with the CoolSculpting procedure, we just don't see some of the side effects that you can see with liposuction. Let's go to the next one. So what kind of results can you get? Well, we get up to 20 to 25% reduction after one single treatment. And of course, some people might need more than one treatment to get the results that they need, and that's totally fine. But 20 to 25% reduction after one treatment in the office, and we have data to show that these results last for 9, maybe even more years. Now, caveat to that is if you start doing your CoolSculpting and then you decide you're going to eat a bunch of cheeseburgers, you probably won't see those long-lasting results. You have to maintain your diet, a healthy diet and exercise, and add CoolSculpting to that to achieve your results. And again, you can see all the areas where CoolSculpting is indicated on the right side of this slide. So what I'd like to do now is hand it over to Misty, our esthetician and our aesthetic RN, I should say, excuse me, in our North Austin office. Now, Misty has had a lot of experience in dermatology. She's been with Sanova for over 6 years. She has got a ton of CoolSculpting experience. She's a graduate of the CoolSculpting University, which is a specific training given by Allergan, who owns the CoolSculpting. And she said that she loves CoolSculpting because it's life-changing. And she said it's helped her feel more positive after she had her 3 babies and attractive after she had her 3 babies. So I'd like to hand this over to Misty. Thank you, Misty. She may be on mute.
Here I am. I've been found. I'm not lost. I would like to just take a little time to thank everybody for taking moments out of your day to listen to us about CoolSculpting and get a little bit of more knowledge. I'm going to review like the consultation day, what you might expect when you come in to see me or Stacy or Caitlin or Angie at our locations that we offer CoolSculpting at. And I'm going to kind of briefly review kind of some of the things that Dr. Lane says, that the reduction is usually between 20 and 25% in the area that's treated. Some people want more, some people want, so we can retreat that area more than one time. You just have to wait 4 weeks in between treatments. Side effects, the most common ones are bruising, swelling, and a numb feeling. Dr. Lane did say there's some discomfort. That is true. Most people say on the abdomen, it feels like they did a really good ab workout. So it takes a couple of days for that to go by. We measure our results. I do personally with weight and with pictures. Weight is not because I necessarily expect people to lose weight, even though they're losing fat cells. I don't know how it works, but it's true. Most people do lose their fat and their weight stays the same. In pictures, we do that before your procedure and after your procedure. During your consultation, I may mark you, I'll pinch on you and kind of determine what areas are good for treatment. You let me know what areas you want. I may or may not mark you depending on if it's the correct fat or if it's adipose fat, which is what we can treat, which is on top of the muscle, or if it is visceral fat, which is underneath the muscle, which is around the organs. We cannot treat that fat. It has to be pinchable fat. And I may mark you just to make sure that we are in agreement on what area you're wanting, and then I can kind of advise and let you know how many treatments you might need. If we could get it done in one treatment, which doesn't happen a lot, but it can happen depending on the amount of fat you're treating, or if you might need another cycle or 2. And that also varies. If you get the full 20 to 25%, you may be happy with one treatment. If you're a little bit less, maybe 15%, that might be an area in which we need to treat twice. And everybody's different. There's no way for us to know exactly how each person's going to respond. I think that is pretty much what I would talk about. I mean, it's really kind of getting to know you and what you're wanting. I'm going to pass it on to Stacy. She's a licensed medical esthetician and certified laser technician at Sanova Dermatology in Pflugerville. I worked with Stacy for over a year. We worked hand in hand, and she is a fabulous esthetician. Stacy, it's all you.
Okay. Thank you so much, Misty. Hello, everyone. So I am going to talk today a little bit about how to prepare for your appointment. One thing that you really want to do is make sure that you've got some comfy clothes on. Things like yoga pants, just something that has a little bit of looseness to it. It's also a good idea to make sure that you have eaten something. A lot of times patients kind of come in and they think, oh, well, I'm doing a procedure that is, you know, body contouring, trying to get rid of fat, I'm not going to eat. But it's actually quite the opposite. We do want you to have something in your tummy because, like we talked about, the cycles can be 35 minutes at a time, and you can get hungry. The other thing that you want to remember is to bring some type of entertainment. We do provide Wi-Fi, so if you want to bring a laptop or something like that, you can do that. We also have Netflix. Some patients like to bring headphones just to listen to music and relax while they're having their treatment done. Lastly, probably what you want to remember is that the area that is being treated, that it's clean. There hasn't been, you know, any type of product on the skin before you come in. You don't want to have like a rash, obviously, on the area that we're going to be treating, things like that. Those are pretty much how you get ready. The beauty of this treatment is that it is really no downtime. It's not that much to do to kind of prepare. Next slide. Okay. And this is Angie. I'll pass it over to Angie. She's in the Dripping Springs area.
Hi, guys. Office. I've been in dermatology for 16 years. I've been at Sanova Dermatology for 10 years. And I've been doing CoolSculpting pretty much since the beginning for 9 years. And of course, I've been to the CoolSculpting University. So I'm going to tell you a little bit today about what happens after your treatment. So once we get you in the chair, we get you hooked up to the applicator. When it's done, when that bell rings, I'm going to take it off, and it's going to look like a frozen lump of butter. And to me, that's fantastic. That means we've got some really good crystallized fat cells there, and that's what we want to do. I'm going to do a 2-minute massage, and that massage is going to break up that crystallized fat cells, so you'll get better results. And we've seen studies that show a 60 to 70% better result when we do this massage. It's a little uncomfortable, but totally worth it. In the following days, you may experience some tenderness, swelling, numbness, a little mild soreness. I'll tell my patients to wear compression garments. That will help to alleviate the discomfort. And you can also take over-the-counter pain relievers if needed, as long as your provider approves. Working out is totally fine after your treatment. In fact, the increased blood flow from the exercise is going to help to speed up the healing process. This is a completely non-surgical, non-invasive procedure. There's no downtime. So you can return to all normal activities immediately after the treatment. Just make sure to maintain a healthy diet and continue to exercise to really enhance your results. And now I think I'm going to pass it on to Miss Caitlin Sharman. She is our licensed medical esthetician and certified laser technician in our Steiner Ranch location.
Hi there, can everybody hear me okay? I'm Caitlin. I'm here at the Steiner location, and I have been doing medical aesthetics for about 5 years now. I also have been doing CoolSculpting for about the same time, and I've also gone to CoolSculpting University. So lots and lots of treatments I've done, which is super fun. So I'm going to tell you a little bit how long until you see results and how long they're going to last for you. Typically results can be seen after about 4 to 6 weeks. That's kind of the start of it. Most commonly, your biggest results are going to be seen about 2 to 3 months post-treatment. So that's going to kind of when you get your final results. Like Dr. Lane had said, you're going to just process those fat cells after they've died off. Unfortunately, it's not an instant result, but they just take a little bit of time to kind of get out through the body and just get through the lymphatic system and go away. So that just takes a little bit of time. So 4 to 6 weeks, and then 2 to 3 months for your full results. As Misty kind of talked about, you can do multiple treatments if you would like. So if we did decide on that consultation day that you need to do more than one treatment, we can definitely do that for you. And we would schedule those out, like she said, about a month apart. So you don't have to wait the 2 to 3 months. We can kind of get it all in and get you to your desired results a little bit quicker for you. And typically, best way to maintain, I think everybody kind of mentioned this, is just going to be eat a healthy diet, exercise, just kind of keep up on it, kind of maintain those results as best you can. And I think that for a lot of my patients, I have seen that this is a good little jump start for them to kind of get motivated to either, do that workout you weren't thinking of doing, or maybe not go eat that food that you were thinking of cheating and having. So I definitely think that it's a good little way to kind of jumpstart all that. But and results are permanent as far as the CoolSculpting goes. So once the fat cells die off, they're gone, and you're just ready to go. So that's kind of what you can expect as far as the results.
Perfect. Thank you so much, Miss Caitlin. Let me see. I believe our next journey is going to be going over the results, and these are actually results from CoolSculpting patients at Sanova Dermatology. So Misty Gray compiled a great before and after gallery, which we have more photos than the ones that I'm showing you today, but I just pulled some of the more exciting photos and the ones that show different areas, so you could see just how phenomenal the results are. It's amazing and crazy how great these results are. I was blown away. And then I do have some questions. If you guys want to go ahead and put your questions in the chat box, I've got a few of them already. And we are kind of speeding through here, which is great, which will give us more time to talk about those questions that you have, because I do want to make sure that you feel comfortable and have all the information that you need before you schedule your consultation. And then after the results, I will go over today's promotion, which I know a lot of you guys are excited about, and so am I. So let me go ahead and hand it back over to Misty Gray so she can kind of quickly talk through this results gallery, and then we'll get to your questions in the promo. So let me just get her going, and then we'll be ready to go. Let's see.
All right, I'm here. Can everybody hear me? Yes, great. This young lady was a mother of 2. She came in and she was postpartum, I want to say 18 months. She had been working out and trying really hard to get rid of her belly. And I believe, I can't read that, but I believe we did 2 petites on her. And then she came back 4 to 6 weeks later and we did her pictures. And actually that is her follow-up for 4 to 6 weeks. That is not necessarily normal. That I would have expected those results maybe at 3 months. But that was her 6-week follow-up, and she did get those kind of results with 1 treatment. We did not do multiple treatments on her. And this one, she just didn't like her lower abdomen. She kind of played around with not doing anything because she was trying to get pregnant, and finally decided that, you know what, I'm having problems getting pregnant. I'm going to quit worrying about it. I'm going to just do my CoolSculpting and worry about my body or having a baby later. Her first ones, we did the treatment. She is one of the patients that jumped off the table and said, come on, we need to hurry. I got kickboxing class in 35 minutes. So I got to get going, and I got a 20-minute drive. And then when she came and followed up, she was actually pregnant. So we did not do any more. She said she would have if she didn't become pregnant after the first treatment. This one was an older lady that she just felt like she looked like a balloon. We actually used our Cool Max. Now we have the Advantage Plus for that size. But the Cool Max, we just did it a little bit below the belly button. And you can just see how well it just turned out for her. She just looks less bloated and more tight and tone. CoolSculpting does not let you say that it's a skin tightening procedure. I know we get a lot of questions about loose skin. In this case, she did nothing but reduce the fat. And I mean, yes, her skin is looser, but it doesn't appear to be in her, I guess that is her underwear. I was gonna say her bikini, but it's her underwear. Okay, Taylor, the next one. And this one was a gal that was starting a keto diet. She just decided that she was done being overweight. And this was early on in her journey. And we used her as a model on a CoolSculpting Live, actually. She doesn't tolerate pain well at all. She's kind of she knows that I would say this, that she's kind of a wussy. But we did, in these pictures, we did the upper abdomen. We did 2 cycles, like an upside down V shape. And then later we did do the lower one with a max. But in this picture, I think we're just talking about the top treatment with the upside down V. And this is another lady. She's a grandmother. She just wanted to be able to, bend over and tie her shoes a little bit better, get up and move around with her grandkids. She just felt like she wanted to look as young as she felt and be able to move like that. And we treated her abdomen. I do believe that one is diamond shaped. I can't really see it on my slide, where we did 4, a V on the bottom and a V on the top. And that is with 1 treatment. So we did 4 cycles in one day. And this is another lady that we did her upper arms. She was very concerned about how it looked. She hated it. She liked to wear sleeveless shirts, but had issues with it. In this picture, I was kind of concerned, thinking maybe she'd have a little bit more skin laxity. So we talked about that. She did use the SkinCeuticals body tightening serum on that with it. But as you can tell, it looks like she has a lot of, contouring. I mean, it just looks absolutely amazing. And that woman was in her mid-60s in that picture. And this one was a older gentleman that was retired. He worked at the hospital and did like deliveries of flowers and stuff. He just didn't like how his pants, he wore a big belt buckle, which I'm sure is, awesome in Texas. Everybody has a belt buckle. And he said when he would sit and talk to the patients, it would cut him in the belly. So he really didn't care about cosmetic reasons. It was more that his belt buckle, and he wasn't wanting to give up his belt buckle. So I said, yeah, we can shrink you. His results were way more than 20 to 25%. I would say it's more closer to 50%. When I saw him, I told him I thought we would need to do 2 sessions of 4 cycles. This is his 6-week follow-up, and he just did phenomenal, and he was absolutely ecstatic. If he were my husband or my dad, I would have tried to tweak it a little bit, but he's like, I came in to wear my belt buckle, and I got my belt buckle, and I'm happy. He ended up giving his 4 extra cycles to his wife because we didn't need to do a second treatment. And this was a younger guy that was trying to cut weight. And we did 4 cycles on him, I believe. And he was starting a new exercise program with it. So yes, you can kind of tell that he slimmed down a little bit as well with the CoolSculpting.
So now I'm going to go through the questions here that I have. Someone had a question earlier about bruising. My estheticians, does someone want to take that question? Can you give me a thumbs up if you want to take it? Misty Gray. Go ahead and go.
Bruising was a lot more prevalent with the older hand pieces that were an hour long. Now we may see some bruising, but it's not really common. You get more petechiae or more hickey-like that usually goes away within 24 to 48 hours. But some areas bruise a lot worse than others. I would say upper arms are one that I tend to get a lot of bruising. Upper arms and then flanks, just because of the tightness and the fibrous tissue. But there's not a lot of bruising anymore with the newer technology, which I believe we have at all of our locations.
Perfect.
And
I stole it. I'm sorry.
Oh, I was gonna say, and it depends on medicines, of course. If you're on a medicine that may thin your blood a little bit, you might be more apt to bruise than somebody that's not. Or if you had a couple of glasses of wine the night before the treatment, which you can do, it may thin your blood just enough to cause a little bit more bruising than the average person that didn't have a glass of wine.
Perfect. Thank you so much. That's great information. Sorry for cutting you off there. Still learning. And then I have a gentleman ask about a massage. Would an additional massage, like going to a spa to receive a massage, enhance the results at all after your treatment? Go ahead, Angie.
So we don't have clinical data beyond that 2-minute massage immediately post-treatment. So we know we want to do that. But you can absolutely do massage. Will it help? It's certainly not going to hurt, and it will definitely speed up that lymphatic drainage to get rid of those fat cells quicker. So absolutely go for it.
Amazing question, or amazing answer. I'm sure that we all love the concept of getting a massage.
Yeah, right.
Let's go for it.
Yeah, absolutely.
Then I've got a question here, and again, whichever of you estheticians feels most comfortable, please raise your hand. Someone said, can it treat pubic fat, so kind of down in the lower area? Has anybody treated there, Misty? I see you shaking your head. Give me an answer there.
Yes.
You can. Okay, perfect. And I had a lot of people asking about specific areas to treat. I think I can answer for all of the estheticians when saying there are quite a few areas that are not specifically listed that we talked about that can still be treated. The best way to figure out whether or not those areas make you a candidate for treatment is to come in for consultation. This in no way are we trying to like swindle you to force you to come in, but it is the most effective way for us to be able to see whether or not you're a candidate, because like Misty said, there are multiple types of fat and we can only treat certain ones. Like certain ones are able to be treated with this treatment, and so we don't want to overpromise if we haven't seen you in the office, and a lot of it involves us physically pinching your fat on your body to make sure that where you're being treated is the most effective. So hopefully that answers some questions. I did see a question about being pregnant after being treated. Does someone want to take that? Like, is that going to severely modify your results if you got a CoolSculpting treatment before you decide to get pregnant? Does anyone want to take that on? Misty?
I will.
Oh, Caitlin, go ahead.
Yes, I was gonna say I will if no one else will, but I don't want to.
I don't think that it'll affect, I mean, once the fat cells are gone, they're gone. You can always, like you said, gain weight, and it's going to show in, different areas of the body. Those fat cells basically expand everywhere else. But in the areas that you've been treated, they typically, once they're gone, they're gone. So if you get back down to the weight that you're at before you had baby, you're going to maintain those results.
Perfect. Will we see thigh results is one of the questions. And I know the answer to that question because I have seen some of the photos and they were not in the ones that I showed, but I know that we've seen quite good thigh results. Has anyone seen really good results with thighs? Angie, do you want to give a quick explanation?
I've seen amazing results with inner thighs and outer thighs. I wish I could show you a picture right now, but yes, very good result.
Really hard to treat.
Of course, once you come in for your consultation, we can tell you if you're a really good candidate, if it's going to work really well for you as well, or if maybe not so much. But definitely it's possible to get really good results.
Perfect. Will we be provided with what the cost per cycle is? So like I said, it's kind of difficult to be able to give a full explanation of what your expected package pricing would be, just because it depends on how many cycles you do. So throwing out a number right now would not really be very informative, just because it's going to change based on the person. So the estheticians I know would be more than happy to do a phone call with you before coming in for your consult. I know that we're amenable to doing a virtual consult, which is a little bit trickier, but possible. And then also scheduling a consultation. Perfect. Let's see here. Would dry brushing before or after be helpful? I am not super familiar with dry brushing, so who wants to take that on? I'm seeing Misty shake her head no. I'm assuming that means it won't really have too much of an effect before or afterwards. So like Angie said, I'm going to go ahead and say it's probably something that's not going to be a negative impact on the procedure, but we can't boast that it is something that's going to make a positive impact. Let's see, does this treat cellulite and inner thigh lipoma? I definitely want to hand that off to someone. Does someone want to take that on? Angie.
I'll say this, I have treated a lipoma before. It was on the underarm. You know, my doctor, he ordered it. He had a discussion with the patient, and this was the route she wanted to go. She didn't want to have surgery. So we did CoolSculpting on it, and we got really great results. I can't say that it was 100% gone, but it was definitely much improved. So again, whenever you come in for that consultation, we'll have you consult with our providers, with our doctors and our PAs to ensure that that is the best option for you. But potentially we could do it on a lipoma.
Perfect. And then I can speak quickly just because our time is running up here. I do know that that we cannot make any promises about CoolSculpting treating any sort of cellulite. That's kind of a whole different monster there, and the estheticians are more than skilled enough to be able to talk to you about those options. So that would be a great question for them during your consultation, is to talk about what options can help with that, whether that be a skincare item, whether that be a laser treatment, whether that be resurfacing. There's a lot of things that we can do. And if you don't feel comfortable with making those decisions until after you get your CoolSculpting treatment, I would highly suggest that.